Page 13. Additional Wellness Resources. Alliance Work Partners. The Employee Assistance Program provides a confidential source for information, referrals, and counseling to employees and eligible dependents. Through Alliance Work Partners, AWP, you have access to counselors and information that can help with several interpersonal issues. Call 800-343-3822 for more information on the listed subjects. If counseling after 6 sessions is recommended, the EAP counselor can help you find extended counseling resources in conjunction with your medical coverage. You may also visit their website, www.alliancewp.com. Page 14. Dental plans. Dental coverage is provided through MetLife. You may choose one of the 3 dental plans: a managed care, one of 2 preferred provider organization plans, or out-of-network including specialist. All dental options cover preventive, basic, and major care. The managed care plan and the PPO high plan provide orthodontic benefits. The DMO plan provides in-network benefits only. Enrolled members pre-select a primary care dentist from the Find a Dentist directory and visit that dentist for all dental services. There are typically no calendar year maximums, deductibles, waiting periods, or claim forms. Patient co-payments may be required for certain procedures. If you choose one of the PPO plans, reimbursements are based on usual, customary, and reasonable fees. Some dentists or specialists not in the PPO network may charge more than the UCR rate. You are responsible for additional charges. Benefits are paid after a $50 per person per calendar year deductible has been met. There is an annual benefit maximum of $1,000 per person per calendar year. While participants may choose any dentist or specialist under either PPO plan, selection of a contract network dentist will provide participants with the highest level benefits and save on out-of-pocket costs. Page 15. Dental plan continued. On page 15, you will find dental plan costs and plan features. Page 16. Vision plans. Examination. 1 eye examination, including dilation when professionally indicated every calendar year, is covered 100%. Frames and spectacle lenses. 1 pair of spectacle lenses and frame every calendar year from Davis Vision Fashion Collection, covered at 100% after a $10 co-payment. A $130 allowance towards the cost of any network provider's frame. A 20% discount will be extended on any balance over the $130 allowance. In addition, many lens types are included, while others are offered at significantly discounted rates. Contact lenses. Covered in full each calendar year from Davis Vision Contact Lens Formulary, or a $130 allowance towards the cost of any contacts from the provider's own supply. A 15% discount will be extended on any balance over the $130 allowance. Members selecting standard soft contact lenses are entitled to an evaluation fitting. For specialty contact lenses, a $60 allowance plus additional 15% discount off any coverage will be applied to the evaluation fitting after a $10 co-payment. Out-of-network coverage. Reimbursement up to the plan maximums for an eye examination and eyewear. Using the benefit is as easy as call the network provider of your choice and schedule an appointment. Identify yourself as a Davis Vision Plan participant. Provide the office with the member's ID number and the name and date of birth of any covered child needing services. Out-of-network benefits. You may receive services from an out-of-network provider, although you will receive the greatest value and maximize your benefit dollars if you select an in-network provider. If you choose an out-of-network provider, you must pay the provider directly for all charges and then submit a claim for reimbursement. Page 17. Income Protection, Life Insurance, Cigna. Basic life insurance for you. The City of Farmers Branch provides basic life insurance coverage at 1 times your annual salary at no cost. Additional life insurance for you. You may add to the life insurance provided by the city by selecting coverage in $10,000 increments up to 6 times your annual base pay, not more than $500,000. You pay premiums on an after-tax basis, so any insurance benefits paid are not taxable when your beneficiary receives them. Dependents Life Insurance. This coverage will pay benefits to you in the event your covered spouse or children die. You may elect coverage for your spouse with a minimum coverage amount of $10,000 up to 50% of your employee's supplemental coverage, no more than $100,000. You may also elect coverage up to $10,000 for each child. If you elect coverage for your children, all of your eligible children are covered from the age of 15 days to age 24. You pay the same regardless of the number of children. On page 18 of this benefits guide, you will see that the initial monthly premium is based on age at time of enrollment and the amount of coverage you select. You will also find out how to calculate supplemental life insurance premiums. On page 19, you will see that the initial monthly rate for the spouse is based on the spouse's age at time of enrollment and the amount of coverage you select. You will also calculate supplemental life insurance premiums for your spouse and children. Page 20. Accidental Death and Dismemberment, AD&D Insurance Coverage. If you are injured or die as a result of an accident, you or your beneficiary will receive a benefit based on the extent of the injury. AD&D pays for benefits if the accident occurs as a result of and within 365 days following the covered accident. The City of Farmers Branch provides basic AD&D insurance coverage through Cigna at 1 times your annual salary at no cost. You can add to this coverage by electing voluntary AD&D insurance coverage. You may choose additional coverage for yourself in $10,000 increments. Premiums are paid on an after-tax basis, so any insurance benefits paid are not taxable when your beneficiary receives them. Long-term disability insurance benefits. Disability coverage helps you and your family meet financial obligations if injury or illness prevents you from working. It provides a continuing source of income if you are unable to work as a result of a disability. The City of Farmers Branch provides long-term disability insurance coverage through Cigna at 60% of your annual base pay up to the age 65. The maximum monthly benefit is $8,000 per month. The plan begins to pay benefits after a 180 calendar day waiting period. Disability means you are under the care of a physician. Long-term disability benefits are reduced by other sources of income during disability, such as workers' compensation, Social Security, and/or retirement systems. Monthly cost to reduce the waiting period to 90 days, 11 cents per $100 of base pay. Page 21. Voluntary Supplemental Plans. Supplemental insurance plans can help fill the gaps created by co-payments, deductibles, loss of incomes, and various out-of-pocket expenses not addressed by major medical plans. As an employee, you receive basic benefits such as medical insurance from the city, but even with this coverage, there may be gaps in your insurance, which supplemental insurance can help pay extra expenses. With supplemental insurance plans, you choose the types of coverage you want to pay for through payroll deduction. And because your premiums can be paid on a pre-tax basis, you may save tax dollars or even be able to add benefits without affecting your take-home pay. Page 22. Flexible spending accounts. You can pay for eligible healthcare and dependent care expenses with pre-tax income through a flexible spending account offered through MGIS. You do not pay a federal income tax on your deposit. The flexible spending account reimburses you for eligible healthcare expenses that are not covered by insurance. How the spending accounts work. You choose to contribute part of your earnings into the medical flexible spending account and or the dependent care flexible spending account. The accounts are maintained separately and you cannot make transfers between them. These accounts will reimburse you for eligible expenses through the year. Flexible spending accounts contain a grace period for incurring eligible expenses. This grace period will allow plan participants to continue to utilize any balance remaining toward eligible expenses incurred through March 15, 2012. This will apply to both FSA health and dependent care reimbursement plans. While this does not eliminate the use it or lose it rule completely, you now have additional time to avoid forfeiting unused funds. Healthcare Flexible Spending Account. Number 1. Estimate your annual healthcare expenditures on items not reimbursed by insurance. Number 2. Decide how much money you want to contribute to the account from $1 to $416.66 per month. The money is deducted before taxes, so taxes are withheld on a lower amount of your earnings. Number 3. The city offers a debit card that allows eligible expenses to be deducted directly from your account. Number 4. You may also file a paper or online claim when you have eligible health care expenses. Dependent Care Flexible Spending Accounts. Number 1. Estimate your dependent care expenses for the coming year. Number 2. Decide how much money you want to contribute to the account from $1 to $416.66 per month. The money is deducted before taxes, so taxes are withheld on a lower amount of your earnings. Number 3. File a claim when you have eligible dependent care expenses. You will be reimbursed for eligible dependent care expenses. Number 4. You will be reimbursed for eligible claims up to the current contributed amount available in your account.